Recorded. So, good evening, everyone. And once again, this is Rolandas from Megagen, and thanks for taking the time to join our fourth Megagen webinar. Today, we're pleased to have Dr. Maziar as our guest speaker with the topic failure phenomenon from a different point of view. Dr. Maziar is a chairman of MENEC Study Club of Iran, an honored member and lecturer of International MENEC and Dental XP experts as well. And as I heard, Dr. Maziar placed over 15,000 implants during his practice. So is that true? Doctor, any comments?
Yeah, more than 15,000. That was from 1 year ago. Yes.
Wow, that's really superb.
Yeah.
So, and since when? So since in 1 decade and 55 decades, because it's really a lot.
I started placing implant dentistry from, I think, 2000. Yes, 2000, 20 years ago.
All right.
And from 2010, I started to place any-ridge implant. Okay. And I think I was one of the first ones after Dr. Park.
Yeah, okay. Because,
yeah, it's an amazing implant, yes. And 10 years with any-ridge.
So we have 10 years of follow-up and everything works pretty fine for you.
Yes, yeah,
perfect.
Exactly.
That's perfect. So as this event is live, we will collect all of the participants' questions during the presentation, and Dr. Maziar will answer the questions at the end of the session. So please, all the attendees, don't be hesitated and ask whatever you want about all of the topics that you're going to hear. So let me hand you over, Dr. Maziar, and the stage is yours.
Thank you so much, Rolandas. And thank you, Sean, for having me this. In these days of the virus, when many of us are confined to our homes and confined to a different, more inbound horizon, a different way of inhabiting that 24 hours, it's interesting to think about our disciplines or micro-disciplines or themselves. Many years ago, Timothy Wilson, psychologist, wrote a book with its evocative title, Strangers to Ourselves, which we have been introduced to that stranger in us, which may be in control of much of what we do, and we really have a glimpse of it. So now it's time to think about this and be familiar with this stranger inside us. Hello, my friend. I'm Dr. Maziar Dowlatshahi. It's my great delight to be with you in this webinar series, amazing webinar series organized by MENEC Study Club, especially in these situations with sadness and sorrow, but there is hope and happiness in it, I'm sure, for recovered people, for healing people, how much people are helping each other. It's amazing, inspiring, and promising. We have to think about ourselves in this time, and we have time to do this and ask this question, who I am really and what I am passionate for, especially in this or area of our work. What I am passionate so much about implant dentistry, just doing dentistry, just placing implants better and more accurate, or there is a bigger picture. Caring our patients. In these days, we change. Everything will be changed, and it's very good to observe this change inside us to become more mature and wiser. Speaking of wisdom, I will walk you through this webinar into a little bit to implant dentistry, and then I focus on failure phenomena, emphasis on the knowledge about this phenomenon. Let me introduce another stranger inside me, other than periodontist. I don't know what's happening. Okay. Another stranger inside me. I love horse riding, and when you ride a horse, you live in a moment, just a moment, and you will be disconnected from everything, just you and your horse and the feelings. Exactly the same way I'm placing implants, just me and my implants and my case. I'm disconnected from everything. And you cannot put yourself in implant industry on autopilot. Every case is different from another one. And this is so much exciting about implant dentistry. I'll talk about this later. Also, another stranger inside me. I'm a theater director, playwright, and screenplay writer. And this is my last play, Requiem for a Girl, 30-day night performance. And theater is really amazing. It's kind of keep digging inside you and yourself and find every time you find something new, and it's amazing. Okay, let's back to periodontist inside me. And this is the trailer for the my play, Requiem for a Girl. Yeah. Okay, let's back to periodontist inside me. Let me ask you this. I always ask this question at the start of my webinars or lectures, because this is very important question in our career, in our job. What these catwalkers do not smile? Look at them.
In the way that one learns how to use scissors. Not everything is mechanical and robotized. The hands always intervene. But a workman's tools are changing the times.
See?
I love shoes.
No smile. Why? Because if they smile, you cannot see any other thing except the hair smile. You cannot see the hair, the clothes, accessories, nothing except their smile. Because smile is very important in gesture, in aesthetic. Smile is the key to aesthetic, and this is the hard point of our work. Our work is very hard because we have to design this smile, redesign it, construct it, reconstruct it. It's very important. Smile is key to aesthetic. If only a little one, like this, or a Duchenne smile, like this. Smile is the key to aesthetic. Implant dentistry offers a very predictable treatment option for tooth replacements. You know it very much, a long way since the 1980s, from that situation to this harmony of aesthetic and function. And the trends demonstrate a strong need for implant therapy and demands getting more and more. By age 50, the average American is missing more than 12 teeth. And with very high success rate, more than 90–70%. It's very high, but I'm talking about this number later on. I will focus on this. And with many benefits, you know this. Preservation of alveolar bone, preservation of adjacent tooth structure, stability of removal process, with many benefits. All of you know it. For example, look at this pen. This situation could be avoided from the first place with precise decision-making and treatment plans, to put it more simply, with our knowledge and experience. When deciding to retain a tooth with questionable or hopeless prognosis, it's very important to know that allowing bone loss to continue, progressive bone loss to continue, will maybe compromise your future treatment plan. And the bone loss can occur years after wearing a removal partial denture. Look at that level of bone. It's very important that this situation could be prevented from the first place with precise decision making. And also, this situation could be prevented. Loss of tooth structure. More than 70% tooth structure can be lost by preparation for fixed partial denture. Can be prevented with placing implants. Okay, all of you know that, but complications occur. Complications occur, and nobody likes this. Lengthens and compromise the process, jeopardize all of our efforts, further cost and procedure, and bring sorrow, pain, and dissatisfaction for our patient. That is very, very important. Nobody likes these situations. Complications or failure. Nobody likes this. All of these situations are failure. From osseointegration point of view or from aesthetic point of view. These are failure. Nobody likes this. And we should reduce this rate. And how? I will talk about this. In the Art of War book, you know that. For knowing this phenomenon, we should aware of its predictors. It's our enemy. We should know its behavior and predictors. The most predictors are the major ones: patient-related factors, implant characteristics, and most important one, clinicians' experience and knowledge. Recently, Thomas Lenkiewicz in his great book talked about these factors, but in other ways, in other words, operator-dependent factors, misdiagnosis factors, and zero bone loss factors. I'm stuck with the patient-related factors, implant characteristics, and clinicians' experience and knowledge. These factors work together, merge together, and overshadowing at some point, somewhere on each other, but the most important one is clinicians' experiences and knowledge. First one, patient-related factors should be thoroughly assessed by patient habits, smoking habits, soft tissue assessment, thickness of soft tissue, level of soft tissue, thick biotype, thin biotype. This is very important. And bone quality, bone quantity, and very important, I will talk about it later on, genetic polymorphism. Genetic polymorphism. And also, very important, patient demand. Look at the gap in Willem Dafoe.
People have suggested that I fix them, but I like my gaps. As my father used to say, son, your teeth are air-cooled. Gaps are openness, possibility, room to savor. The greater the gaps, the greater the contact, greater the feeling.
The greater the gaps, the greater feeling. Patient demands is very important. Okay, after patient-related factors, there is implant-related factors, implant features. These are the features and conditions that we have to consider and make the right decision based on these features. We should know our implant system features very carefully and decide which features is good for our patient. Every patient has different needs. So we are the director. They act or play with their features, with their performance, and we have to decide which is good for us. So we should know the dimensions, the coating, surface, loading protocols of that implant system, the locations. Some implants are good for some locations or different kind of bone quality. So we have to decide which one is good. So our knowledge and experience is very important. Different designs, different threads, through type. There are so many features out there, but we have to decide. We should know our implant very much. let me tell you something about the mind process. There is a process in our mind which we call it cognitive ease. For example, in every situation, we have a mindset about it. If we have a repeated experience with that situation, you can imagine, for example, implant placements, implant situations. If you have a repeated experience with that situation, with that implant system, clear display of that, if there is a coherence, or you are primed with that system, you are in a good mood, then you have a cognitive ease about that situation. Your patient and your system, your implant system, you have a cognitive ease. Then you feel familiar with this, you feel it's true, you feel you trust it, you feel good about it, and you do it effortlessly. This is very important. If you have a cognitive ease with your implant system, you can go beyond some small complications because you have trust in it. So you can be more confident about that. What I'm saying is, you should know your implant. I'm not saying that start with your old system or old concept or old machines or systems or old implants. They are very good. I'm not saying that. I'm saying you should know your implant very well. You are the rider. You should know your horse. You should know your horse. You should feel it in every situation, in every climate, in every position. You have to feel your system. You are the rider. Okay, the most important one, clinicians' knowledge and experiences. This is the implant story. You have knowledge about implant from your faculty. You have it. So start with simple case, placement, and get your own personal way. This is a very important point in your implant life. Get your own personal way. After this level, you can learn from others. You can learn from literature. You can learn from presentations. You can go to symposium and learn something after this level. And then you can place advanced cases. And after all of this, you will find that there is no difference actually between simple case and advanced case. But you have to start. You have to start and get your own personal way. And there is I will talk about it later a little bit, about this story. It was this circle. There is an inner circle that is your mind and your mindset, your concept, and an external circle. It is the methods, the techniques, and the knowledge. Okay, so data from patient-related factors and data from implant characteristic factors come through your mindset. You process this situation with your knowledge and experience, and the output should be and have to be a precise decision and treatment plan. This is how it works. Look at this from different view. The knowledge, I'm talking about knowledge. And talking about the failure phenomena. We are talking now about the predictors for failure rate and success rate. Trends in implant dentistry shows that 80% of all implants are restored by only 20% of dentists. In other words, 80% have not yet realized the full potential of dental implants. Because of that lack of knowledge and experience, you can decide that you want to be in which part, that 20% or 80%. You can decide, and you have to build these things for you to move forward. Okay, this is very important. 80% of implants are restored by only 20% of implants. Okay, we talked about the predictors, but based on, if you read the Art of War book, you know it. If you want to know, as a hunter, if you want to be a better hunter, you have to know your prey's behavior very good. And in deep, you have to know your prey's behavior. You have to know the failure behavior and pattern. Implant failure has a cluster behavior. It means it's not randomly distributed among people. Failure clusters within subjects, not necessarily in same area or same quadrant, in same patients. So there are high-risk groups, there are high-risk individuals for implant failure. Let me talk about it more. In an innovative analytic method with Cox proportional hazards to show the correlation within subjects and the risk among subjects. It showed that risk among subjects varied significantly. Means that implant failure tend to cluster within subjects. There are high-risk subjects. You should know the failure pattern. If you see one failure in one patient, the probability for watching another implant is more in that patients compared to other one. So failure cluster in individual. There are high-risk groups. It means it's based on genetic polymorphism. Look at this analysis, 8-year analysis. 3,609 implants assessed. So survival rate, 97%, more than 97%. It's perfect. I will talk about this number later. But look at this, 2/3 of failures in 1/3 of patients. 2/3 of failure in 1/3 of patients. There is cluster behavior and there is high-risk patient. More than one implant failed in 32 patients, high-risk groups. One implant failure in 32%. And prosthetic failure more predominant in patients with more than one failure, and prosthetic-related factors and occlusal-related factors have more role in cluster behaviors. This is very important to consider biomechanics, prosthetic-related factors, and make or prepare or design a stable occlusal pattern for our patients because they have more role in cluster behavior. This is very important to know that. Okay. Implant failure acts as domino effect that may cause more failure in one patient. Domino effect. Remember this. So, we talked about the failure and the predictors, how we can reduce its rate or increase the success rate. Interdisciplinary approach, communications, and planning leads to success. Patient assessments in every aspect. Medical history, thoroughly, completely, and do it carefully and slowly. You have time for this. As my very good friend Miguel Stanley presented a very good concept, slow dentistry. Do it slow. Give time to yourself and your patients. Because there are relative contraindications and may decrease our predictability. So patient assessment, very important to increase the predictability of treatment plan. And patient assessment, you know that in dental point of view, anatomic limitations, aesthetic and phonetic evaluation, lip position, I said that before, smile line, gingival height, thickness, thin biotype, thick biotype, bone architecture, quality, quantity, everything should be assessed carefully. So, limitation of hard tissue and soft tissue, you can see this, you know that. So, bring help, get help from CVCT and digital planning. Make your virtual patients in your office before starting implant placement or any treatment. design your crown, assess everything, soft tissue and hard tissue in occlusal view, in sagittal view, in cross-sectional view, design your prosthetic very well, and then based on that crown or process, make your implant based on that. So your implant placement will be based on prosthetic driven concept or biological driven concept. This is very important. Do it prosthetically and biologically driven. You design it in your office, in your virtual patient, and you can map it and register it to your actual patient and do it exactly at the level of very high quality, quite wide accuracy based on what you planned it before. You can, there is so many tools for that, for intraoral scanning, intraoral digital impression, STL files. You can get your soft tissue and hard tissue inside the mouse and merge it with your CBCT to make your virtual patients. It's so helpful. And you can make guides for that based on that design, based on that treatment plan. You did it before. You can make your aesthetic guided surgery and place implant exactly where you want to place it with accurate direction, accurate length, everything. You plan it before and you do it exactly the same way in your patients. Computer assisted implantology or static guided surgery. Also, you can do it dynamically there are many systems about that to do that. The dynamic navigation system or dynamic guided surgery. You design your crown and implant in the software exactly the same you want it to be, and then you merge and map and register your actual patient jaw relation, everything to your CBCT into the software, and you track your bone jaw, patient jaw, track your handpiece, track your drills, length and width. And when you start your osteotomy and or placing your implant, you place it in this field of target field. You can see your drill exactly, and you can place and do your osteotomy exactly the same way you planned it before, in length and everything. It's so accurate. So you can use static guided surgery or dynamic guided surgery. What I'm saying that not just buying tools, you have to raise your concept, your knowledge, and bring help and get suitable and appropriate tools for that concept. Occlusal related factors are very important. I said it before, I mentioned before. So digital occlusion assessment and T-scan, it's very helpful. You can assess your occlusion digitally and can make a stable occlusion for your patients. Also, you can get help from tissue engineering. You know that PRF is so helpful, especially for soft tissue enhancements and generation, and for your wound healing. Also for GBR, for making sticky bone, is so helpful and will improve your outcome. So, optimal aesthetics, phonetics, and occlusal function is our ultimate goal. Okay, we talked about the major predictors, we talked about the techniques and the help that you can get. You know what you need to do, but who you need to be to use these tools, to use this system, to do these things. You need a self-development to be that person, okay, to be that person to use these systems. Who you need to be. It's very important. Clinicians' experience and knowledge, how we can raise it. Again, this is your story. You have to get your own personal way. You have to get your own personal way, and then you can learn and be better surgeon or clinicians. We are not Pinocchio. Methods and how are secondary. Your concept and your vision are primary and paramount. For unless like dressing a wooden image in the clothes of a man. This is very important. The person inside you is very important. You have to know it very carefully, and then you can use the techniques and methods. So this is the very good part of my webinar. I like to talk about this. Good is good. Good is not good enough. Have you ever heard of typo-scudding? Well, typo-scudding is where a company like Google posts advertisements on websites that are commonly misskilled. And they sit back and rake in millions, banking on the fact that you are watching something like Microsoft.com or Gmail.com. I think this is kind of silly, yes? But what about this? Recently at Amazon, an engineer made a similar, seemingly key error, a little key error. I mean seemingly, because this little typo made a produce a huge slowdown in internet and cost $160 million in just 4 hours. More scary, a worker in a pharmaceutical manufacturer didn't clean the lab very carefully, and we got 700 contracted meningitis and 76% died. This is so scary. Well, I'm saying that when did we come to live in a world with this kind of common mistakes, with this doing your best attitude, with good is good enough concept was acceptable? I'm saying that we have, at some point, we have stopped valuing perfection. And these are the results we get. You can see it now in this situation, this virus situation, because we stopped valuing perfection. We have to seek perfection. And I think we need to get to it fast. I mean, less than perfection has consequences. I'm talking about that 97% success rate. Less than perfection has consequences. Forget, do your best attitude. We need to get to perfection. We have to seek perfection. Let me tell you an example. Give you an example. What about 99.9% accuracy? Is that good? Okay. What about in Merriam-Webster dictionary? 99.9% accuracy in Webster means 47 misspelled words in it. What about our hospital? 99.9% accuracy in our hospital means 11 newborns baby would be given to wrong parents every day. It's so scary, 99.9 accuracy. We have to seek perfection. Less than perfection has consequences. So good is not good enough. And the first barrier for doing this, for moving forward to making that person that is very good for placing implant, is good practice. The primary barrier to do that. I said it before. There is an internal journey. There's your concept, your mindset, and external journey together. Methods, courses, everything, and outside. Okay, we have to move forward based on internal journey and external journey. So if you want to move forward and to be that person, And seeking perfection, you have to make a solid practice foundation based on your visions, your character, your team, and your branding. This is very important. Vision, primary focus should be on effectiveness, not efficiency. Be effective, doing the right things that maximize patient satisfaction and referral. And do the right things for your patients, care about the patients, and do the best treatment plan for your patient. You cannot compromise. Don't go for efficiency and do it slow, as I said before. Slow dentistry is very good, has a very good concept by Miguel Stanley. And build your character. It's not your talent. I'm not talking about this. It needs another workshop, but you have to make your character based on caring, enthusiastic, honesty, and fairness. Very professional team, very professional team. You have to make a very professional team from the start point to your office. Everything. And brand you. It's not a flashy advertisement, what you, the brand is the image of you in your patient's mind. You have to make that image that tells the patients who you are, what you do, and how you do it. Who you are, what you do, and how you do it. This is your brand. This is the image that you have to make it based on your target people to become well-known and well-regarded, both well-known and well-regarded. After this, you are close to that person that can be a very good clinician to reduce this failure rate or increase the success rate. So aim for perfection. Less than this as consequences. Forget doing your best mindset. And do effectively, not efficiently. Do excellent dentistry on lesser people to reduce your failure versus compromise dentistry on more people. And you need a long-range strategic planning. Thank you, my friends. Thank you for having me here. I'm here for any questions that you have. Thank you, Rolandus, for
That's right. Thank you. Thank you, Dr. Maziar, for your outstanding presentation. It was really interesting to listen to all of it. We didn't receive any questions, but maybe some of the guys from the audience maybe want to ask something, or so we have time to do that right now. So you are possible to raise the hand or just type your question in the Q&A session, or just raise a hand and I will be able to unmute you and you will have a choice to speak with the Dr. Maziar live. So okay, so we don't have the question, but we have the thank you message from the Kazal, I think. So thank you all attendees once again. Thank you, Dr. Maziar, once again, as we were saying before. And the next Megagen webinar will be on May 13th. So that means the next Wednesday, when our guest speakers are going to be Dr. Marcus Engelschach and Dr. Miltiadis Mitzias, with the topic of short implant therapy, success, survival, and differences. Yeah, it seems so. Yeah. Also, maybe I can ask you, from my point of view, question for you. So what do you think? Is it more important? What is more important for the training for skill? What is the most important things to find yourself, like to train more, to get more skills, to see what other guys are doing and take the
I'm sorry, I hadn't your voice a little bit. What is the most important thing for what?
What is the most important thing for self-improvement?
Yeah.
What I think is just to take the to learn from the mistakes that others are doing, or just to go forward, to move forward, never get back, never give up, and just don't listen to the naysayers.
I get it.
Yeah.
It's very good questions. As I talked before, eventually we have to start, but we have to get our own way of action. We have to make it. We have to make a concept for ourselves, and after that own way, getting that own way, we can learn from the experiences, and they will not misguide us because we have our own concept, and we can learn now from experiences of others, from literature, from going to seminars, everything. But first, we have to gain and get our own personal way. For doing that, I said it before, we have to make a solid foundation based on our vision. For example, effectiveness. Maybe at the first time we lose some patients because we are doing this slow, because we are so precise about the diagnosis and everything. And after that, become better and better about these things. And after we build our vision and concept based on effectively, not efficient, be an efficient dentist. We have to build our characters. We have to build a very good and professional team. That means a lot for our patient and us. It needs a different talk and maybe webinar or workshop. And we have to make a brand. After these 4 cornerstones for our self-development and solid foundation, we can move forward.
Yeah, I think that's very important to start not from what to do, but why we're doing this. So
yes,
just start
exactly.
with why. I know.
Exactly.
I think you know that book as well. So
yeah, exactly.
And as I noticed, you were speaking about the failure occurring in the clusters. Yeah. So, but what causes the clusters? So, in your experience, how do you analyze what causes the most failures and how you're managing them?
Yes, very good question and very hard to answer because it's based on genetic polymorphism. We cannot assess the prototype of genetic prototype of the patients, but there are some hints about that. Maybe they had periodontitis before, for early onset periodontitis or aggressive periodontitis can be a good sign about that. Maybe he or she is susceptible for that, or any disease that maybe overshadow or periodontium, and any disease that make our immune system become weak, maybe a good sign for these things, for failure behavior. But we have to monitor our patient about this because of that. A step-by-step treatment plan and treatment sequence of treatment is very important. First, we have to, after the emergency, we have to start with type 1, phase 1 treatment. After phase 1 treatment may take about 2 or 3 months, several visits and scaling root planning, and it's a cause-related therapy. During this time, we can get something about our patients. We can get some information about the behavior of the patients. And then after phase 1 therapy, we go to phase 2 therapy, that is implant placement. So because of that, the phase 1 therapy or cause-related therapy phase is very important to assess the patients, to design a better treatment plan for our patient and for better diagnosis.
Okay, thank you. And also, as you said, most of the problems are related with periimplantitis. So as yesterday, I was reading one of the articles how the doctors are treating them. So my question would be, what's your option? Because there are really plenty of different discussions. You know, like we have just one treatment plan is just to remove the implant and that's it, and place another one immediately. Or we can treat it to make something more stable, to make soft tissues and the hard tissue stable around the implant, and how you're doing it in your own practice.
Yeah, it's failure is a multifactorial phenomenon, as I said before. We have to analyze every step. This is from patient-related factors or implant-related factors. It's because of clinicians or our knowledge and experience. When we find out that which part is responsible for that, we can move forward based on that. This is very important to make sure which part is more important. For example, is from the occlusal point of view, we can fix it. If it's from the patient-related factors or there is a disease behind this situation, we can control it and make a very predictable treatment for that. But after peri-implantitis, we have to assess the history and the current situation, the level of bone loss, which implant system we are doing, we are placing or placed, and how the severity of bone destruction, the level of bone loss, severity of bone loss. There are multifactorial. Based on, if we break it down to different level and different categories, we can take care of it in better view, with better concept.
Okay. So thank you once again for the answers. And as I see, we didn't get any questions more.
Okay.
So also, guys, if you would like to know more about our special Megagen program or check our pre-recorded lectures so you missed, please go www.imegagen.com.
Right.
All right, so thank you once again, Dr. Maziar. Thank you, guys. Keep in touch. Stay safe.
Stay safe.
Yeah.
Take care of yourself and your loved ones.
Yeah.
Thank you, Rolandes. Thank you, Sean.
Thank you. Thank you,
Thank
Doctor.
you.
Bye.
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 Bye.